like to greet everyone who's watching this video. Today is Saturday. It's as we can see on the board is August 13, 2022. Um, the topic of again, my name is Yanick Dantiste. Uh, uh, I am a family nurse practitioner who live in West Palm Beach, Florida. This is where I live, and this is where I have been working in in nursing field, and after that in nurse practitioner field for more than 20 years as a nurse practitioner, and more than 30 years as a registered nurse. So that's why I have decided to um, really to teach the community and the population about health promotion and disease prevention. So I don't really have a format, but wherever whatever I think is good, we will be discussing. And whenever I have a live um, um, person, on the video, so they can call me and ask me for questions. So today we're going to be discussing about two topics. The first one will be aware and care. I'm going to tell you guys what it is, but it's going to relate it to Palm Beach County and Treasure Coast. And the second one will be an update of COVID-19 as per CDC as of August 11, August this week, okay? Because COVID, as we can know, been starting since really 2019. That's why they call it COVID-19. But really, we got the big bang of it 2020. So this is a pandemic, and apparently now when we're walking, it look like um, COVID is done, but no, COVID is not done. We still have COVID. However, because of we have treatment, because the vaccination, people get less sick, but the people still have COVID. People still have, some of them have mild symptoms, some of them has more severe symptoms, but uh, the disease is not gone. It's still there. So we have to. There is thing we can do. We can um, protect ourselves. So we will go um, more in details. Um, as always, before I start digging, into the topic, I would like to start with an inspirational quote, like a thought, like just to remind you, guide, to remind, and also some quote I see that they can lift you, lift your spirit, lift your soul up. So the inspirational quote for today says, stated like this: remember to take care of yourself. Sometimes you get so busy taking care of others that you forgot that you are important too. So I'm going to repeat it again. So the inspirational quote for today is: remember to taking care of yourself. Sometimes you get so busy taking care of others that you forget that you are important as well, or important also. Yes, it's true, because as a healthcare professional, I can see, I cannot tell you how many times I see, especially the couple, especially the women, they are taking care of their mate. There's nothing wrong with that, okay? However, they are neglecting themselves. So what I mean by that, let's say the wife, they have their own illness, their own diseases. Sometimes they have high blood pressure, diabetic, and so often what I've been seeing, they are doing everything for their husband. They are they are doing everything from cleaning, cooking, giving their meds. But the ladies, the wife, they are neglecting themselves. So sometimes I go, to their house, and I ask the wife, because you can see if somebody really taking of themselves, the way they are talking to you, the way they are depressed, and the symptom they tell you they have been having. So, and sometimes for some reason I said, okay, let me take your blood pressure, and that the blood pressure is so high, and I asked um, the wife, I said, do you have high blood pressure? Yes. Are you taking medication? Well, I have medication, but I didn't have time to take it. So it's very important. That's why that inspirational quote is so important. We have to remember that. So remember to take care of yourself, even though you're taking care of your loved one. But if you're not healthy, you won't be able to take care of your loved one. And so often what ended up happening is that uh, the one who's taking care of the loved one, they end up dying first because they're so exhausted. So taking care of yourself first, and then you can have strength, you can have the health to take care of your loved ones. So having said that, let's dive into the topic. So aware and care. Um, what is it? So aware and care, it's it's a website, okay? As I said before, it's pertinent to Palm Beach County and Treasure Coast. What is Treasure Coast? Tre- Treasure Coast is a region in Flo, is in Florida East Coast, and that comprise Indian River, Morton County, of course, the Palm Beach, and the St. Lucie County. So there's two important phone number um, I'm going to give. Okay, so the first one, let me erase that. Okay, the first topic is aware and care. Okay, so what is that? Aware and care has been uh, developed by Palm Beach County for prevention and interventions. So if you go to that website is www dot, oh, my W doesn't look good. I erase that. www dot aware and carepbc.com. Aware and care pbc.com. So this is a very important website, okay? That website, if you go there, you can learn about mental health resources. You can learn about preventing mass violence and how to report suspicious behavior. As we can see, as we been realized lately, um, we have mass uh, violences, in the U.S. and Palm Beach County, uh, Florida State is not exempt. So we have been having our own share as well. So there's two numbers. So when to call 211. The first one is 211. When we have to call it. So 211, if you live in Palm Beach County, and if you live in the Treasure Coast, which is the region, like I said before, uh, into the Florida coastline, east coast of Florida, which comprise Indian River, Martin County, St. Lucie County, and Palm Beach County. So that's the Treasure Coast. So if you live in Palm Beach and Treasure Coast, so when you have to call 211, just that, pound 211, you have to call that. You have to call that number. This is a helpline. So you call it for suicide prevention. Okay. If you or your loved one, you are contemplating for suicide, you have the idea, you have a plan, please call 211, not 911, 211. And also crisis intervention. Crisis intervention can be anything from, if you have your loved one, or if you have a neighbor, they are schizophrenic, and you see that they are unstable, they have knife. So this is a number you call, 211. Also, if you need any referral to community services, information assessment, uh, so this is the number you call. Assessment, I'm talking about the mental health. So it's 211. So this is when you use the 211 number. And as we know, the other number is, and also, yeah. So remember, the website is, if you go to that website, you will find more information. And also remember, the website is it's easy to remember. It's www.awareandcarepbc for Palm Beach County.com. So that's it for the 211. Now 911. So I don't know other states, because I live in Florida. I don't know other state if they still use 911. I'm not sure, but I know in the state I live, which is Florida, we call for emergency, we call 911. So 911, we call it for what reason? When do we need to call 911? When we have immediate threat to person or property, um, when there is in progress crime. Okay, um, if you acknowledge a crime, or you witness or what have you, this is you call 911. Also, a serious crime has occurred. Okay, you witness a crime has occurred, so you call 911. A suspicious circumstance that may indicate imminent danger. So if you have a suspicious circumstances that you think that the danger is imminent, so you call 911 also. And the dispatch is available 24 hours, 7 days a week. And as is the same thing for 211. The 211 also, the dispatch, it's available 24, 7 days a week as well. So this is the two numbers is very important to remember. So to recap capitulate. So the first number was 211. Okay, the 211 is mostly for mental health. If you witness, or either you or you have a loved one or a neighbor who has issue, suicidal, they want to kill themselves, they are in crisis, you need a referral to community services for mental health, please call 211. They are available 24 hours a day, 7 days a week. They will send help. So this way people don't have to suffer. So there is help. So the thing is when to ask for help and where to ask. So that's why I think that it's important for people to know about those two numbers. So the second topic will be COVID-19 updates. The reason I want to emphasize with COVID-19 updates, every week, every month there's new stuff. And as a healthcare professional, I like yesterday I went to somewhere, and then one person told me, Yannick, how is the COVID-19 is it, do we still have it? What is the new update? And what I realized, everybody everybody they are taking their own stuff. They don't go to the sources. If you live in United States, the CDC, let me erase that. Well, the second topic is COVID-19 updates. Okay, so this is the okay. So as I said, if you live in the United States, the main source to go to find the most recent information is CDC. Okay, so if you go CDC .gov, www.cdc.gov. CDC stand for Center Disease Control. So all information about health, this is where we go. We go and get those information, and they are up to date, and they are based scientifically. Okay, there's research. They are not telling you think according to what they think, according what their brain tell them today. It's scientific research. You know, uh, they do studies, research, so they base on scientists. So it's not from the word of mouth, because in the general populations, people say this, they say that, they don't even base it on nothing. So that's why I always tell them, go and read, and then you will decide for yourself, what do you think. So this is the website to go if you want to know any information, any updates, not even though COVID, anything about diseases, about illnesses, about immunization, you go there. Okay, so that's the CDC. So the CDC, what they do is, they guide the general public to put, they guide them how to protect themselves and how to understand their risk as well. So as of August, this update is as of August 11. This is when this is Thursday. Okay, so see, what they said. Um, so the CDC again is just streamlining for COVID-19 guidance to help people better understand their risk, how to protect themselves and others, what action to take if they're exposed to COVID-19, and what action to take if they are sick or test positive for the virus, which is COVID-19. COVID-19 continue to circulate globally. So COVID-19 is not finished, it's still there, globally. So in the in the world, it's not only in the US. COVID-19 is still in the US, still in Canada, still all other part of the world. However, this is the difference, okay? The difference now and 2020, 2021. So, however, with so many tools available to, uh, to us for reducing COVID-19 severity, there is significantly less risk of severe illnesses. There is less risk of hospitalization and death compared to earlier in the pandemic. So, like they said, because of the tools we have now, what are those tools? Vaccination, testing, and treatment. We do have treatment for these two in the US. They approve for FDA approved them. I know there's many of them, many other treatment, but they're not approved. Okay, people, they can say whatever they want, but FDA did not approve them. There's two approved treatments from FDA. So if you were affected, you have the symptom, and there's a time frame, you have to be within that time frames. So so we are in a stronger, okay, according to CDC said we are in a stronger place today as a nation, um, with more tools like vaccination, the boosters also has been helping a lot, and the treatment to protect um, yourself and your communities from severe illness from COVID-19. Um, Also, there's a better understanding how how there's a better understanding of how to protect people from being exposed to the virus COVID-19, like wearing high quality mask, testing, and improve ventilation. So let's stop on wearing high quality of mask. What they mean by that? There's many masks, in the market, and there is many masks people wear. So I have some example of mask. Um, so when they are talking about high quality of mask, they are talking about N95. Okay, so high quality of mask for COVID-19, high quality of mask for COVID-19. They're talking about um, N95. So that's what they are talking. Okay. So what is N95? It's a mask like this. Okay. So if we have a mask like that, you see how it is. So you put that, behind your head, and you see it's like that. So you can see it is written N95, M3, and it's very it's very thick inside, so that will protect you. You put it that, and your nose, you press that, into your nostril, your nose, so you can seal it. So it's really, um, this is the mask they call high quality mask for COVID-19. Other than this mask, we can find those simple hospital masks like this one. Okay, so it's everyday things we use, to protect, from particles, people who's coughing. We use that, and this one also. Usually, the patient use that, if they are in the hospital and they move, if they are going to do testing for something, so we give them those kind of masks. And also, there's cloth mask, from cloth, from tissue. So this is, like, personally, I use this, if I go to to the groceries, or I go someplace, someplace people have, my friend home, so I use that. But hospitals, if there's non-COVID cases that I know, to protect myself from particles, from, let's say, if somebody speak, talking close to you, whatever, we can use that. But the really high quality mask for COVID is the N95. So this is that kind of mask we use. So the guidance of CDC acknowledges that the pandemic is not over. Okay, the CDC acknowledged, like I said before. So when we walk, on the street, we go to the supermarket, we can think that COVID-19 is over. Sometimes I see, all the people, they, most of them, they don't wear mask, and they're still coughing. So you can think, but as CDC said, they acknowledge that the pandemic is not over, but also, the guidance will help us, okay, to move to a point where COVID-19 is no longer severely disrupt our daily lives. So the guidance, the CDC is giving us, it help us, at least to live a more normal life, like in 2020, 2021, everybody will, we mostly will stay inside, quarantine. Most of workers works from home, but now we can see that thing is coming, coming back to normal. But still, we have to protect ourselves, especially if we know somebody is sick. If you know somebody has symptoms, somebody is symptomatic, we still have to protect ourselves. Um, in support in this CDC, okay, what CDC says, if is to continue, CDC will continue to promote the importance of being up to date with vaccination to protect people against serious illness. So, what is the rationale of vaccination? The vaccination really, it's really it's like any other vaccination. It doesn't mean that you're not going to have it. People think, oh, I meet so many people who tells me, well, even though we are vaccinated, even though people are vaccinated, they still got COVID. Yes, we know that they will have COVID, but the severity of the illness won't be the same. The people will be less sick. Myself, I am a prime example. I had vaccination. I did my two um, I got my two, the first dose and the second dose, and I got COVID, but the severity was much less. I didn't have to go to the hospital. I stay home. I drink fluids. I took my Tylenol. Well, I did take some antibiotics, um, and then thanks God I was okay. But I think if I did not vaccinated, that would be different. That's what I think. So having that, having vaccination that protect people from serious illness, hospitalization, and death. Protection provided by the current vaccine against symptomatic infection and transmission is less than that against severe disease and diminish over time. Okay, so that's why we need boosters, because the vaccination effect will diminish over time. So that's why we have to do the boosters, so the viral load will we can still have it in our blood for protections, especially against the currently circulating variants. So now and then we have different one. Okay, I think now it was Omicron, and I think there is a new one who has been, each time apparently the virus they muted themselves. So for this reason, CDC has said it is important to stay up to date, especially as new vaccine become available. So that's why now and then, between my educational topic about health promotion and disease prevention, now and then, maybe once a month, I will come with updates of CDC about COVID-19 guidance, because I think it's important people really knows what the scientific word says about it, um, because there's a lot of informations outside, and it's not necessarily the right one. It's not necessarily the scientific one. It's what people think. And health is very important. It's not what you think. It has to be based on sciences and on scientific evidence all the time. Also, updating is guidance for people. Okay, so by updating about COVID-19, so it's the guidance for people who are not up to date on COVID-19 vaccine, on what to do if exposed to someone with COVID-19. So the update will give you guidance what to do if you're exposed. This is consistent with the existing guidance for people who are up to date on COVID-19 vaccines. Recommending that instead of quarantine, if you were exposed to COVID-19, you wear a high quality mask for 10 days and get testing on day 5. So now what CDC said, now instead of being quarantined, before they said, if you've been exposed, you are quarantined. Now what they said, now if you're exposed, like if like you went to work or your loved one had COVID or your coworker had COVID, you were exposed to that, you don't have no symptoms. Now the CDC said instead of quarantine, now you use your high quality mask, which is the N95, which is this mask we use. Okay, not this one, not that mask. Those masks, they cannot protect you from the virus. So it's this one. So we use that. Okay, they said you use that mask for 10 days, and then you get tested on day 5. So if you were exposed, you don't have no symptom, but you know that you were exposed, use that and the K95, and on day 5 you get tested. Okay, because you might go the day one to from 5, you negative because the incubation period is not, it's more than that. So that's why they want you to wait on day 5. And also, CDC, they are reiterating that. So they are advised that regardless of vaccination status, okay, CDC said regardless of vaccination status, you should isolate from others when you have COVID-19. So if you were vaccinated, you got your 2 vaccination, you got your booster. Now I think we are on 4th booster now. So regardless your vaccination status, if you were, um, um, they said that regardless that. So if you have COVID-19, okay. So what they said, you should also isolate it, okay, if you are sick and suspect you have COVID-19, but do not yet have test result. So if you were if you were sick or you suspected that you know you if you suspected that you have it, so now is the time to isolate it. Okay, if your result, so now say you go and do your test and you positive, so now you need to follow the full isolation recommendation, right? You quarantine, you stay for 10 days, and then no contact with others, so you quarantine. If your result is negative, so you can end your isolation. Okay, so um, this is, so we got it. This is a recommendation. So regardless your um, vaccination status, okay, you vaccinated or you're not vaccinated. If you know you were exposed with COVID or you sick, you have COVID, you need to be isolated until you do your test. So if you positive for COVID, you follow full CDC isolation guideline. You stay for 10 days, quarantine in your house, wherever you are, you quarantine. And if it's negative, so you stop the isolation. And also, the recommendation also is that you test for COVID-19. We recommended that if you test for COVID-19, you stay home for at least 5 days and isolate from others in your home. So why? Because you are most likely most infectious during the first 5 days. So that's why they tell you to stay in your home for 5 days. If you are if you test for COVID-19. And also wear the high quality mask, which is the N95, when you must be around others at home and in public. If after 5 days you are if after 5 days you are fever free for 24 hours, okay, if after you have COVID, if after 5 days you are fever free for 24 hours without the use of medication, you are, after 5 days you don't have no fever, you didn't have to take any medicines, and your symptoms are improving, so what CDC said, and you never had symptom, okay, so you never have symptoms, so you may end the isolation after day 5. So what CDC said, after 5 days, okay, you are home, you had COVID, so after 5 days you are home and you never have symptom, but you were testing, your tests were positive for COVID. After 5 days, if you're home, you don't have no fever for 24 hours, you didn't use no medications, uh, um, your symptom improving like weakness, if you have headache, your symptom improving, or you never had symptom. Okay, so the isolation can stop for 5 days. Remember, before it was 10 days, now it's 5 days. You don't have to be isolated after 5 days. Regardless of when you in isolation, avoid being around people who are more likely to get very sick from COVID-19 until at least day 11. Okay, I'm going to repeat that. This is very important. Regardless of when you end your isolation, avoid being around people who are more likely to get sick. So, who are those people who are more likely to get sick? So, people who are more likely to get sick will be immunocompromised people. Okay, uh, immunocompromised people. So, who are those people? People who have AIDS, cancer, and people who have chronic diseases such as diabetes, um, hypertension. We can include that too. Hypertension, uh, chronic kidney disease. Okay. So that's meaning those people, they are immunocompromised already. So that's meaning that they are, to begin with, they are not healthy, okay, because of those conditions: AIDS, cancer, diabetic, hypertension. If it's not controlled, chronic kidney disease, dialysis patient. Um, the dialysis can be that too, because they are, their health, they are compromised. So those people, okay. So if you have to be, regardless of when you're in isolation, avoid being around those people. Um, if you were testing positive for COVID, at least day 11. Okay, on day 11, after you've been tested, and even though you end your isolation, at least wait after day 11 to be in contact with those compromised people. So I mean, we have to protect them. And also they said you should wear a high quality mask through day 10. Okay, so if you test positive for COVID-19, so the recommendation is to wear this mask, not those masks or the cloth mask. So is the N95. Sorry, that's the high. That this is what they call high quality mask for COVID-19. So recommendation is that, if you had moderate illness, such as if you had experiencing shortness of breath, like difficulty to breathe, or you were hospitalized due because of COVID-19, or you have a weakened immune system, which mean that, cancer, like I already raised it. You have cancer or AIDS. So they said that you need to isolate it through day 10. Your isolation, so let me reframe it. If you have been tested positive for COVID-19 and you have moderate uh, illness, such as you have fever, you cannot breathe, you have difficulty to breathe, okay? Generalized, you are sick. So they said that, and you were hospitalized due to the COVID-19 because you were so sick. So they said that um, you need to be isolated through day 10. It's not day 5. They go back again, day 10. So also they recommended if you have severe illness, severe illness that will require hospitalization, of course. So, or you have a weakened immune system, consult your doctor before ending isolation. Okay, if you had severe illness, either you were hospitalized or not. If you're hospitalized, that's fine. But if you're home, but if you have severe illness, most likely you will be, hospitalized. But if they discharge you before, okay, because lately, like I said, like I keep saying, lately, healthcare in the industry look like they are going into crisis. Why I say that? The trend is that when people they are admitting, we see there's a pattern, they want to discharge them home early. Okay, sometimes the sick person, they're not even ready. Okay, they want to discharge them early. Sometimes they need, somebody has to speak for them, somebody has to speak up, call the nurse, call the doctor, tell them, hey, my loved one, is still weak, my loved one is still coughing, and they are going to tell you, there's nothing else they can do, but you need to really see, you need to compare if is that person baseline. If it's not that person baseline, try to speak to the doctor or the nurses to see if they can stay more. But this is a crisis. I always say that people don't stay for long in the hospital. They want to discharge them sooner. So we have to be, the loved one has to really helping out to see if their loved one really ready to go back home, because when they go back home, there's not too much help at home. So I believe people who is sick, who's very sick, they should stay, in the hospital and get the maximum care they can get until they feel good, until they feel at their baseline, until they go back home. This is my take. This is my opinion. That's what I think. Um, so they said that, yeah, if you have if you've been testing positive and you were sick, very very sick, and you are weakened immune system, like you have history of you have medical history of cancer, you AIDS, or other chronic diseases, contact your provider first before you end your isolation. And also, CDC has said that uh, clarify that after you have ended isolation, if your COVID-19 symptom worsen, okay, after, let's say you end your isolation in day 10, and if your COVID-19 symptom worsen, that's meaning if your symptom is getting worse after you stop the isolation, we start your isolation at day 0. So you have to start all over again. Okay, talk to your healthcare provider if you have questions about your symptom or when to end isolation. Is very important, because by ending isolation too early, what that can contribute, that can cause, that you spread it. Okay, you spread the virus to to your to your home or to the community. So it's very important you follow the guidelines and you end it when you're supposed to end your isolation. And also, we recommended screening testing of asymptomatic people without non-exposure will no longer be recommended in most community settings. So before, in the hospital, they used to screen people to see, or if you go in a nursing home or ALF, assisted living, they used to screen. So some places they no longer do that. Some places they still doing it. That's their right. They're doing it, but the CDC do not recommend that. So they can stop it if they want to, but it's up to them. It's up to their policy of the facility if they want still to keep testing, screening people. And also, CDC said also, and they should emphasize that physical distance is just one component of how to protect yourself and others. Okay, it is important to consider the risk in a particular setting, including local COVID-19, community level, and the important role of ventilation when assessing the need to maintain physical distance. All right. So, um, s- so all that to say that COVID-19 is still here. People still have symptoms, but because of the tools we have, such as vaccination, the boosters, the treatment, um, even though people they are contacted COVID-19, they are less sick and they require less hospitalization. And at the same token, we have to be very careful also to protect others, especially others who are sick, who is chronically ill, such as people who has cancer, people who have AIDS, um, newborn child, newborn babies. Like I really, especially now we don't know who has COVID, who doesn't have COVID. I will discourage people to go visit home newborn babies, because especially they don't have no defense, they do not have defense. So stay away from newborns, um, and then also please, if you sick, if you sick, you didn't testing yet, try to wear a good mask like the N95, and try to stay away from people until you get tested to see if you have COVID-19. You wait for day 5. Okay, the day 5, that's when that if you contacted that virus, you will be, that will be converted. If you were exposed in day 5, if you tested, most likely, if you have contacted, most likely that will show. Before that, the likelihood is slim. So that's why CDC has recommended to be tested. If you think that we're exposed, okay, or you sick, you have symptom, you're sick, so go test it on day 5, so they can you can have that chance to see if you know, if you were converted. Um, yeah. So just we have to remember COVID-19 is still there, okay? It's still there worldwide. It's still in the United States. It's still in Canada. Um, and it comes, it's up and it come up and down. Sometimes we some months it's more, some months it's less. But we're just keep in mind, even though we see everybody, most of the people on the road, they are very slack, very, very few people wear mask. I still wear my mask. If I go to Walmart, wherever I go, I wear my mask. Um, because like I said, we don't know, we don't know who has it, who doesn't have it. And so many people also, they have it and they're asymptomatic, they don't have no symptoms. So we have to take care of ourselves, because as we know, God only give us one health. And we can have all the money in the world, we can be multimillionaire, billionaire, whatever. If we don't have health, we won't be able to enjoy it. So that's why I love health promotion and disease prevention. I love to teach. I love to uh, educate people. That's why my channel, in YouTube, is mainly educational. Is not to give people advice. It's really to educate you. Based on scientific evidence, and you are the one who's going to go and do more research. And because as we know, knowledge is power. There's no price for for knowledge. More we are knowledgeable, is more we can make uh, informed decisions. Okay. Because it's, you can see, it's people who are not knowledgeable, that sometimes they can decide things, and that can hurt themselves. So please get educated, educated. you know um, you will never regret it. And my goal is to bring you the knowledge that I know, about health, because um, that's why I've been doing for more than 30 years, working as a nurse practitioner, working as a registered nurse. So there's things that people needs to, we have to keep remind people. We have to keep educate people, because education will never end. Will never end. Even though diabetic, we can teach diabetic every day. We're still going to have news. We're still going to learn new stuff. And in any diseases. So that's why we have to be very uh, willing, to learn, to apply it. Okay, if you learn it, you don't apply it, it doesn't make sense. You're wasting your time. So don't forget to always look for new information, new updates. Updates is coming, often. So if you're on your phone, you can look for it. And the website is CDC. CDC, it's www.cdc .gov. Okay, so if you need, whenever someone need more information about what's going on, with COVID-19, or what's going on with monkeypox, or with influenza, whatever infection. So this is a good site to go and search and dig. All right. So on that, I going to remind um, that try to have an optimal health. Everybody, like I said before, no one has 100% of health? No one. Everybody, we are trying, okay? We are trying to have an optimal health. If we have a disease, like if we have hypertension, you are trying to take your medication, you're trying to exercise, you're trying to eat low salt diet, no added salt, trying to drink a lot of water, a lot of fluids, tea, exercise. I cannot stress about exercise. um People think they have to go to, to the gym to do no, walking is excellent exercise, swimming is excellent exercise. Like me, like let's say I go to Walmart or anything, anywhere, I go to BJ, I try to park as far as I can so I can walk. I walk back and forth, and that every little thing will, add. Everything you do exercising will add. Like let's say you're going, inside a building, if it's not too high, you can take the stairs instead of elevator. What I do, let's say, I go into a building and it's ninth floor. Of course, I won't be able to go up to the ninth floor. I may not, what I can do, I can start from basement, I go to the second floor, and the second floor I take the elevator and go to ninth floor. So any little thing will add up, okay? And also, lastly, try to reduce your stress. I know it's not easy, but I'm telling you that will help you tremendously to stay healthy, because stress can cause all those, wide diseases, mental, physical, and everything. So try to reduce your stress as much as possible. Whatever in your life gives you stress, if you can, try to get rid of it, or whatever you can do, try to reduce your stress as much as you can, because we only have one life, one life to live. We have to live it the best the best we can. And no one is responsible for our health except us, okay? God give it to us, so we have to cherish it. We have to do everything we can do. And I think that's where health promotion and disease prevention come in, to help us, through education, um, to knowledge, and it's feasible. So on that, I will wish everybody the best of health, and until next time. Bye bye.